Well, stress affects everybody. And it has affected everybody for as long as history can remember. Actually, the ancient Romans talked about stress. However, stress as we know it was defined about 50, 60 years ago by a physician and researcher named Hans Selye, who used the term for the first time the way we think of stress. And that is that a bad thing happens to you and your body responds to it. So I think most people tend to think only of stress as the bad thing that happens. They don't think about their own physiological stress response. And that's a very important concept to bear in mind when you're thinking about stress, because you can't do anything about the bad things that happen. That's life. But you can do something about your physiological response to stress, or you can do some things about it. Just imagine that you're waking up in the morning and you have an empty sack, an empty bag on your back. And every stressful event that occurs during that day gets put into that sack. And as the day goes on, the sack gets heavier and heavier. And if you're under chronic stress, you are going to be carrying around this weight of stress that is going to have a negative effect on your body. And it's true, a single acute stressor is unlikely to make you sick. If you have multiple stressful events and you have a chance to relax on that vacation, that's unlikely to make you sick. If you have one stressful event after the other and you don't have time to relax, or if you have chronic stress, that's when you're going to get sick. And the reason is because cortisol, that stress hormone that is pumped out by the adrenal glands, is one of the most potent anti-inflammatory hormones that our body makes. Get as much sleep as you need. You need to pace yourself. You need to go offline. And there are many, many ways that people do this. You can do yoga, meditation, prayer, music, exercise, art, whatever it is that you enjoy, that you can get yourself into to get away from those things that you find are stressful. You know, for a long time, when we think about ulcers, back into the 1930s, everybody said, oh, ulcers are just stress. And then when Helicobacter was discovered, the bacteria that causes ulcers, then the pendulum swung all the way in the other direction. Well, it's all just Helicobacter. But the fact is, not everybody who has this bacteria develops an ulcer. And it turns out that stress is a component of it, that something that is released from nerve endings in the stomach when you are stressed may make it more likely that that bacteria will burrow in and you'll have an ulcer. So there are these kinds of discoveries that are being made that explain a lot of what we didn't understand in detail, we as scientists and physicians, but what the public has always known, that stress can make you sick. Stress factors, those adrenaline-like nerve chemicals that are released when you're stressed, can actually cause growth of ovarian cancers. So it's not that the stress causes the cancer. You have to have a tendency, some genetic tendency to develop the cancer. But if you're stressed, it could make it worse. It could make it grow faster because of those nerve chemicals that are feeding that cancer growth. So we're beginning to understand at a very, very sophisticated level how things like emotions and psychological and social factors can be transduced through these nerve chemicals and hormones to have effects on cancer growth, on, as I said, ulcers, and on all sorts of diseases. And so that really makes it important when a doctor or a healthcare provider is seeing a patient to understand their entire context of their world and their emotional and social context in order to really help treat that person and bring them back to wellness. There's another interesting and exciting area of research, which is drug therapy. So we know the brain's stress hormone, CRH, or corticotropin-releasing hormone. That's released from the hypothalamus, and that makes the pituitary gland release another hormone, ACTH, and that's what makes the adrenal glands pump out cortisol. Well, in addition to having discovered the structure of that hormone, which is a small, tiny protein molecule, it's a peptide, Wiley Vale at the Salk Institute and others around the world are developing drugs to block that hormone. And so this is the next frontier of treating diseases like post-traumatic stress disorder, potentially also treating depression. There are actually different sorts of these compounds that are in different levels of clinical trials. They're preclinical right now, but hopefully that will give some hope for a completely new way of treating not only stress disorders but depression.